We'll start with a little brief anatomy review of the eyes. So vision is actually provided by special receptor cells in the eye itself. And these receptor cells are going to send your nervous impulses to the visual cortex and the occipital lobe of the brain. That's why if you get hit in the back of the head, you see stars. Other parts of the eyes are going to focus that light when it enters, so it's detected in exactly the right place in the right way. Now you've got some accessory things, your eyelids, your bony orbits, eyelashes, your lacrimal ducts or your tear ducts, and these are all going to kind of work together to protect the fragile structures of the eye. You've also got 6 muscles that are actually going to control eye movement. Now each eyeball is about 1 inch in diameter and weighs about 1/3 of an ounce. It's a hollow globe, and you've got 2 fluid-filled chambers. The larger posterior chamber is going to be filled with your thick viscous gel, kind of like a KY jelly or something. It's called vitreous humor. And then your vitreous humor is what gives that eye its shape and maintains position of the retina. The smaller, more front chamber or anterior chamber is going to be filled with a watery fluid called aqueous humor. This aqueous humor is going to be produced by the cells of the ciliary body, and it's drained by a structure in the canal of the limbs to prevent your excess buildup. So you've got 3 layers of the eye itself, and you have a tough outer fibrous layer, a middle vascular layer, and then an inner neural layer. That fibrous layer is comprised of the sclera and the clear cornea. The fibrous layer is continuous, and the conjunctiva that lines the eyelids. The cornea itself has no direct blood supply, so it relies on the tears that flow onto the surface for oxygen. What this means for actual eye health is if you have a corneal injury, it can make it very difficult to heal. It takes a long time. I remember when I was, I think about 22 maybe, I actually had a corneal abrasion. That is hands down the worst pain I've ever had in my entire life, but it took weeks to heal properly. And a lot of it has to do with the poor perfusion of the actual cornea itself. Now this vascular layer is going to have your iris, which is that circular pigment area, and that's a smooth muscle which allows for the opening of that, opening and closing of the iris, which is what we see as the pupil. So that's what allows the different little degrees of light into the eye. And you've got 2 muscles in the eye, in the iris, that are going to change the size of the pupil by either contracting or dilating. And the parasympathetic innervation of the cranial nerve 3, the oculomotor nerve, is what's going to allow the pupils to constrict, while the sympathetic nerves allow it to dilate. The ciliary body is what suspends the lens of the eye behind the pupil and acts to change the shape of the lens to allow focus at different distances. So if you ever, have to get glasses, if they tell you you're myopic or something like that, then the shape of that has changed some, which is going to affect how you focus on things. Now, the retina is the neural layer of the eye, and it's an outgrowth of the brain that's connected to the brain's visual cortex. The retina is the neural layer of the eye, an outward growth of the brain that's connected to the visual center of the brain. And so this retina has neural cells and pigmented cells, and you've got 2 types of photoreceptors or light receptor cells. You've got rods and cones, and these are going to be adjacent to those pigmented cells. Your rods are very light sensitive, but they're not color sensitive, and your cones are color sensitive, but not. And your vision is going to be the clearest when the light that passes through the lens is focused on an area of the retina with a high concentration of cones. So these rods and cones, which are stimulated by wavelengths of visible light, are going to stimulate those neural cells in the eye, resulting in a chain of events that's basically going to send this information to the visual cortex in the brain. Now, some specific disorders of the eye. We don't typically think of anything wrong with the eyes being life-threatening, but they can be definitely vision-threatening, which in turn could be life-altering. So they are some important things there that you want to keep in mind. So conjunctivitis is just inflammation of the conjunctiva of the eye, which results in a pink or red bloodshot appearance. It's a pretty common non-traumatic eye problem. It could be from allergies, it could be from a virus or bacteria or fungus. Typically, when people say they have pink eye, they're referring to the viral conjunctivitis, which is contagious. And this can lead to complaints of mild burning, kind of a sand grip feeling in the eye, itching. Bacterial conjunctivitis can produce yellow kind of pus or exudate from the eye, and which can form like a little crust along the eyelids and eyelashes, which may make it hard for the eye to open. If that occurs, I can see where it'd be kind of panic-inducing. Have them place a warm, wet compress over the eye. It's going to help relieve this crusting and allow them to open that eye up. You don't want to pry it open because you could cause some damage there. Right? They need to be diagnosed and evaluated by a physician for diagnosis, and usually some topical antibiotic drops or ointment may be prescribed. If you are caring for a patient with conjunctivitis, wear gloves and remove your gloves immediately afterwards. Don't touch other surfaces, or you could inadvertently transmit it to yourself or somebody else. And make sure you wash your hands with soap and water when you are done. Now, a hordelum or a stye is basically where the duct of a gland along the margin of the eyelid is infected. And usually this is a staph infection, but it's going to cause swelling and other signs of inflammation, warm, hot to touch, redness, that kind of thing. Generally, it's going to be treated with a warm, wet compress several times a day to help promote drainage of that gland. In some cases, severe cases, antibiotics may be prescribed, but most of them are going to resolve on their own. Now, orbital and periorbital cellulitis. This is a super serious bacterial infection of the tissue around the eye, and this can occur as a complication of a sinus infection or other infection of the facial or eye tissues, which could be from an injury, an insect bite, or even a stye. So this periorbital area is swollen and usually a little bit discolored, and they may have some systemic signs of infection like fever, headache, malaise. And for more aggressive cases, they may actually require hospitalization for more aggressive management, so they don't have any vision loss. All right? Orbital cellulitis is just a deeper and more serious infection that's going to cause eye pain as well with any movement of that eye or eye muscle. Now, glaucoma is a vision-threatening condition, and usually when you get called for this, it's due to an exacerbation that leads to severe eye pain. And what glaucoma is actually an increase in intraocular pressure that can damage that optic nerve, and if not treated, can lead to blindness because it can cut off basically the superhighway to the brain there. So this intraocular pressure is going to increase when the aqueous humor in the front chamber cannot drain normally. And then this increased pressure is then transmitted back to the posterior chamber, which then puts pressure on the optic nerve. Glaucoma will normally progress over time, and it'll start with a kind of a loss of peripheral vision, but the pressure can rise real rapidly in some cases, causing eye pain, redness, headache, nausea, seeing halos around lights, or even a hazy looking eye itself. So in this case, that condition is an emergency and they need prompt treatment. Now, foreign bodies in the eye oftentimes are going to irritate the cornea or the conjunctiva, and they can even become embedded in the cornea or penetrate the globe. Small foreign bodies in the eye are fairly common and can be removed by tearing. Whether they're just tearing up or something. It's what their body's trying to do to get rid of it. And the eye may be red and irritated after. They may even feel like they have a persistent feeling of having a foreign body, even though it may be removed. If that occurs, that could mean that they actually have a corneal abrasion there. So superficial foreign bodies can be, treated with gentle irrigation with sterile saline or water. For a small foreign body like an eyelash or small insect or something that kind of adheres to the inner surface of the eyelid, you can remove that by gently kind of inverting or flipping out the eyelid, turning it inside out, and wiping away with a wet cotton tip applicator if your protocols permit. Just depends on where you are. But then they should still be evaluated by a physician for potential corneal abrasions, because those are pretty serious problems. Right? If there is some kind of embedded object in there or object impaled in the globe, cover both eyes, stabilize any protruding objects as needed, and transport. All right? We want to use some kind of eye cover that does not put any pressure on the eyelid or the globe if available. If you don't have any kind of metal eye cover like that, then you could use a small paper cup or plastic drinking cup, just depending on what the size of that object is. The key factor there is to make sure that you cover both eyes, because where one eye looks, typically the other will follow. So you don't want them moving around because it could make that situation worse. Now, if your patient has a sudden partial or total loss of vision in one or both eyes, this could be a very serious condition. It could be a stroke, it could be a retinal artery occlusion, it could be a detached retina. Sometimes it could be a side effect of drugs. You never know. But any sudden vision loss, it could be a neurological problem. We need to transport for further evaluation and for treatment.